Greetings, this is Dr. Douglas Maurer from iMedical Apps with another medical app review. Today we're going to be reviewing another new app from Dr. Joshua Steinberg. I tell you, Dr. Steinberg has been on a roll lately. He has been cranking out some very high quality, easy to use apps for primary care providers, and this latest one may be one of his simplest but best yet. This app is called Health Maintenance Visits, and its point is very simple: to help you figure out what to order, prescribe, counsel, otherwise deal with during any variety of health maintenance visits from the cradle to the grave, prenatal care, well child, well adult. Let's take a look at this app. So you can see these grids are easy to distinguish which group you're looking for, starting with well child to adolescents, adults, prenatal care. He has a little bit of information here about the purpose of a health maintenance visit. And I spoke to Dr. Steinberg about this app, and he intends to add YouTube videos that will discuss how to perform a health maintenance visit and use the information that's in this app to even better effect. But for now, you've got pretty detailed directions here on how to use the app, but it's only going to get better. Disclaimer here, kind of talking about that some of these recommendations are evidence-based, some of them are expert-based, and they're likely to change from time to time. So bottom line, it's up to us to make sure that we stay up to date as recommendations change, because Dr. Steinberg may not get to update the app as regularly as he hopes. You can also see this is one of the first times Dr. Steinberg has teamed up with another provider, this one not too far from where I live, Dr. Paula Digert in Spokane, Washington. References here, most of the information comes from the United States Preventive Services Task Force, Bright Futures, and the ICSI. You can see links to his other apps, including a list of the apps that he recommends folks to look at. I would tell you to take a look at what we have here on iMedical Apps as well. So let's take a look at the app. So a well child visit. This is birth to 4 months, what to screen for, health counseling and education, and chemoprophylaxis. This includes medications as well as immunizations. These grids are really modified PDFs. Pretty easy to use. Not perfect, but pretty easy to use. You can see here how the screening is divided into history, physical, and tests. I just love having this all in one spot. Jumping ahead, let's look at an older child. You can see now we're pretty much at annual child visits, all the way up to age 10. Then moving on to adolescents. And he uses the popular HEADS mnemonic, which is great because that is what the American Academy of Pediatrics recommends. This also includes information on pre-participation or sports physicals. Again, information on health education, immunizations, etc. And then we jump into our well adults, going all the way from age 20 all the way up into our 80s. And this is where information from the United States Preventive Services Task Force really comes into play. And then what I also really love is seeing prenatal visits. From the initial visit, usually these visits occur every month, so 12, 16, 20 weeks, what should be done at each visit. And then the final trimester of pregnancy here, taking us all the way up through post-dates induction time. Again, as you can see, the app is super easy to use, and I think it's one of the best all-in-one apps out there currently available. So things I liked about it: everything you need for prenatal care, pediatric, and adult visits all in one place. It's well referenced with these links, which work to take you right to, in this case, the A and B recommendations for USPTF, which is great to see in one spot. You see the other hyperlinks here as well. The layout is pretty basic. There's nothing fancy about this app, but it gets the job done. Things I don't like about it: to a certain degree, these checklists can be kind of busy. You can pinch to zoom, but in general, they can be a little difficult to see on a small device. There's no evidence ratings for any of these, so it's hard to really tell looking at any one visit, so to speak, what is coming from evidence-based versus expert opinion, what recommendations are Bright Futures versus ICSI versus USPTF. But those are minor quibbles